Physiotherapy. Today I'm just going to be talking to you about a little bit about the anatomy of the body and just focusing specifically on the knee for today. The knee is a certain joint, is a big joint in the body that we often have a lot of problems with. So today I just want to just teach a little bit about the structures that are involved, looking at starting off the bony structures, then looking a little bit about the soft tissue that surrounds the joint, and just so you can understand a little bit about where the pain may be coming from or how it can arise in the first place. I'm just going to use an app to show the details of the anatomy so you can try and understand how it all fits and works together. So the app itself is called Essential Anatomy. It's a really, really good app that I use. It just gives a lot of really good information, good detail into what's going on through the body. So we start off here, we have the skeletal structure. So the whole body from there. As we work into it, we're just going to focus on the actual knee joint itself. Let's go get it from here, sorry. There we go. So we're in on the knee joint itself. So the knee is composed of the tibia, which is the big bone at the bottom, and the longest bone in the body, which is the femur. So those two joints that connect together form specifically the knee joint itself. The patella that sits on top is that small floating bone that sits at the bottom of the femur. So when we often get problems in the knee, it can often be related to this point. So the kneecap that sits on top of the femur. We also have an area that sort of lies below that, which is our fibula. So the fibula is a non-weight bearing bone that connects on the outside of the tibia, but also connects in to form the ankle at the base. So those are the components of the skeletal points of the knee joint itself. So we can see all from there. So the patella, the tibia, the femur, and then we have the fibula also as well. Where the fibula or the femur and the tibia connect specifically is the knee joint. Between those two bones, we have what's called the meniscus. So the meniscus is a sort of like a shock absorber between those two bones. So if we have any twisting, any sort of mechanism which causes any pressure to build up between those two areas, or like a shear force, can often happen in sports injuries for football, can often deteriorate as we get older. So it can lead to weakening in the area as well. And this can lead to small tears. The meniscus is the shock absorber, like I said, but it can often lead to small tears, can often get caught between the two bones. So whenever we're going down into lower levels, or if we're picking things up from the floor, it can often get caught between those two areas. So the meniscus is the shock absorber. We also have a cartilage layer between the patella and the femur. So any area where we have two bones connecting together, there's often a layer of cartilage that protects the two bones from rubbing against each other too much. So that becomes into the cartilage layer through there. Just going to pop on through here. So we have an area of connective tissue that surrounds each joint. So the knee is quite a big joint. It's a hinge joint, so it tends to move in a forward and back motion, but also has a slight little bit of rotation. So we have a little bit of a capsule, which is this connective tissue that surrounds the area. So you can see there a bit better. So surrounds the area of the joint. So this connective tissue layer supports that knee joint and gives it the stability that is required for any twisting and pivot movements that are needed. These little blue dots, these are the bursa. So bursa are a small fluid-filled sac that helps to reduce the friction of where the muscle attaches to the bone. So where the tendon attaches to the bone. In times when we have too much loading in a specific muscle over a long period of time, it can increase the friction on these points and can lead to a certain amount of inflammation. One of the most common areas of the knee where this tends to happen is this small one on the inside. So this is called the anserine bursa. So when I sort of touch in through a few different muscles, as you can see, there's a few muscles that run across that line of the bursa. When that is these muscles are working too hard or they're being too dominant within their muscle, within their connective tissue, it leads to an increase of friction, which tends to lead to a certain amount of inflammation. When we have that pain on the inside of the knee, that's where that tends to come from. When we see that developing, it can lead to a certain amount of loading in that muscle. So to try and improve that, we need to reduce the amount of loading through that muscle group, but then we need to build up other muscles to take a certain amount of strain. So that's looking at the bursa, that fluid-filled sac that can often lead to too much inflammation developing in the body. Coming on from there then, we'll look at the muscle, the structures of the muscles around the body. So there's, as you can sort of see, there's quite a few different layers of muscle that surrounds the knee to provide a certain amount of stability that's required. So that's the knee in its all of its glory, the muscle that surrounds the knee joint. The quadriceps is the muscle attaching from the femur. The name that suggests there's 4 bands of muscle that connect from the hip joint, from up higher around the hip joint, coming down, connecting to the knee to provide the necessary support that's required to extend the knee and also to flex the knee, the muscles coming around the back of the knee joint. So as you can see from here, the muscles at the back of the knee joint are called hamstrings, comprised of 3 different muscle groups coming on the inside and the outside of the knee. On the inside of the knee then we also have our adductors. Our adductors are what can move the hip inside and out to try and get a little bit of deviation of movement coming from the hip. But all of these comprise together support the knee and give it that stability to make it move, but also to provide a certain amount of support from there. So when we're looking at the structure of the muscle, we can have all of these different types of layers. There's one small muscle that sits at the back here called the popliteus, and that gives us that support of unlocking and locking the knee. As I said, the muscles in the front are the quadriceps, so they help us to extend the knee, so giving us a lot of power to force the knee forward, which are comprised with regards running and jumping, and also with the hamstrings in the back that help us with deceleration and sort of forward movement, which again is very important for walking and running fast as well. All of these muscles comprised together generate force and power to move the joints and trying to generate force throughout the body. Muscles can develop a certain amount of strain. So if we strain the muscle, it can lead to a small little tear in these fibers. So they can be graded between 1 to 3, depending on the certain amount of fibers that are torn within the muscle. So again, can lead to degeneration. If we have a weakness in the muscle, we can tear a certain muscle group. Or again, if we are playing sport or if we're doing anything that requires a certain amount of power, then these muscles can also be strained. So like I said, grade 1 is lower than 50% of those muscle fibers. So it can range from recovery levels, so between be a week or even up to maybe 2 to 3 weeks maximum. Grade 2 strain, so looking at a certain amount of fibers torn, that's maybe more than 50%, but less than 75. So that can range from maybe 3-4 weeks, even up to 5-6 weeks on the sort of the higher levels of that injury. Then we're looking at grade 3, where we have a complete rupture of some of those muscle fibers. So that can range from an injury level that can recover from, that sort of 8 to 12 weeks or even 16 weeks in the bad cases, or sometimes in the really bad cases can sometimes require a certain amount of surgery. Following on from that, then we also have ligaments. So I'm going to take the muscles away, and we're just going to look at some of the ligaments that attach around the knee joint. So here we have the muscle, or the ligament, called tibial collateral ligament. We also have the MCL, PCL, ACL. So these are what attach the bones to the bones. And these are what really provide a certain amount of stability in the knee. We tend to injure these ligaments, especially with a certain amount of twisting and torsion, or if we come under against a blunt pressure, can often strain the ligaments in cases like if we're skiing and we twist, or if there's any sort of blunt trauma coming on the inside or the outside of the knee, or coming on the outside of the knee from that side. So that would strain the ligament on the inside, or possibly strain ligament on the outside from the knee. Like I said, these are connective tissues, so they support the knee, the bone against the other bone. If they are strained, what's often required is to build the muscle to help to support the knee again. So any ligament injury is very important that we get the stability back as quickly as possible, and we try and get the support back in the knee to get it moving and functioning properly again. Ligament injuries can, like the muscle injuries, can vary in how quickly they recover. It can vary again from the grade 1 to 3, depending on the amount of fiber that's torn. And again, can vary from 2 weeks, even up to months in the very severe cases. So that's where you require a certain amount of graded activity, graded exercise to try and get you back on track and getting the strength back in the knee to allow yourself to get back into whatever movement or whatever activity is required. So that essentially encompasses the majority of the soft tissue, the anatomy around the knee joint. As you can see, there's different types of layers of muscle that cover the structure of the body. Muscle is there to provide movement and to provide a certain amount of support in the knee joint. We also have the ligaments that also provide a certain amount of stability. If we have any injuries to those, it's important that we get the strength back as quickly as possible. And that we also try and get the movement back as quickly as possible. But depending on the type of injury that's there, it often requires a certain amount of graded return to and progression with regards to the movements from there. Some of the other things that are also important with regards the actual structure of the knee is the bursa. So the bursa is what reduces the friction between the muscle and tendon connecting to the bone. If that muscle or tendon is often overloaded, that bursa can come under a little bit of extra strain. So it increases a certain amount of friction or rubbing across where that attaches to the bone, and then can often lead to an increase in inflammation. So that increase in inflammation can often lead to a certain amount of pain and obviously limiting your amount of movement in the knee joint then from there. The last thing that we looked at then was the cartilage. So the cartilage is the shock absorber between two bones. So we have it between the knee joint, between the femur and the tibia, that sits in through there. So we have two of those. We have a medial and a lateral meniscus, and that's another interchangeable name we can use for that. This tends to arise with regards to certain injuries, with any twisting or pivoting injuries, if we have any falls, and it can often happen in sports as well, even at a young age. It often tends to degenerate as we get older. So as we get older, it's more susceptible to injury. So it's important to have a good, strong base around the muscle to give us any support that we need through there. Lastly, we also have a little bit of cartilage that sits between the patella. And that's the patella that sits between the femur and the bone from there. So that little lining of cartilage, it also sits beneath that. So again, very important to have strong muscles to support all these different areas. The muscles are the only area that we can actually have an effect on. The ligament is a connective tissue, doesn't necessarily change. The cartilage, to reduce the stress on through that, is important as we sort of get older in life as well. And just to understand the mechanism of those types of injuries. So that's sort of looking at the anatomy from today. Very, very interesting joint, very important joint in through the body. We also want to make sure that it's good and strong. Looking at the complexity of it, it's not one of the most complex joints, but it's also a very interesting joint. When we're looking at patella, looking at the complexities between the joint, another area that comes into focus is around the fibula and making sure that that's moving sufficiently enough so that the soft tissue around it is moving well. So that can also have a component in what's going on around the knee joint. So when we look at all those areas and make sure everything is moving well, then that tends to allow the knee joint to move well as well. So we're going to leave it at that. So for today, hope you enjoyed that little bit of work, or a little bit of training, or a bit of advice on the knee joint, giving you a bit of information about what's actually going on in the body and the structures that are involved. We're going to be focusing on the knee joint over the course of the month, and then we'll be looking at a few different areas over the next wee while. So I hope you enjoyed, hope you have a good day, and we'll be in touch soon with some more information about the body. Thank you and take care.